Good morning, and thank you for joining us once again this week. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, our Chief Medical Officer of Health, Chief Darren Rizzi from Mississauga Fire and Emergency Services, Chris Giles, our Manager of Compliance and Licensing Enforcement, and this week, I'm also joined by Paul Mitchum, who is the City of Mississauga's Chief Administrative Officer and our City Manager, and he was here to join me to answer questions about our city's vaccination policy. We introduced a vaccination policy at the City of Mississauga because as an employer, we have an obligation to do everything that we can to protect our employees, our volunteers, and the residents we serve. And today, I'm very proud to share preliminary results that over 90% of our employees who have disclosed to us they are fully vaccinated against COVID-19. This number, however, does not include part-time employees and ATU transit workers, and that's due to the logistical challenges associated with disclosing vaccination status, and thus we're still collecting disclosures from these employees. But nevertheless, I'm very, very thankful to see that so many of our employees have stepped up to get the vaccine. And I'm confident that we will see in all the data when it is in, that our numbers here at the city will reflect the overall community vaccination rate. I want to thank our employees and our volunteers who have already disclosed their status and who have received both doses of the vaccination. You have made our workplaces safer, and you're helping to protect the entire community. I also want to thank you for the incredible work that you've done over the past 18 months, helping residents navigate the pandemic. So many of you have been on the front lines, providing essential services to the people of Mississauga who keep our city running. We simply could not have gotten through the pandemic without you. For those employees who wish to remain unvaccinated or have chosen not to disclose, they will be required to participate in mandatory education sessions where they will learn the benefits of the vaccine. And if they still choose not to disclose or have not been vaccinated by November 1st of this year, they must provide the city with proof of a negative rapid antigen test before entering the workplace. Employees will be required to be tested regularly, with timing depending on their shift schedules. We also continue to make headway in getting more and more of our residents here in Mississauga and across the region vaccinated. About 83% of residents 12 years age and above have now received both doses of the vaccine, which reflects the overall vaccination rate across the province. This has helped keep our case counts low and has significantly helped us limit the impact of the fourth wave of the virus. Peel Region is now averaging just 25 cases per 100,000, and that's down from 29 cases last week. Mississauga is also averaging 25 cases per 100,000, and that is down from 33 cases last week. That is good news. I'm worried, however, about the situation at Trillium Health Partners, which is becoming increasingly tenuous. Right now, Trillium Health Partners is experiencing a higher than expected number of COVID cases, with 31 COVID hospitalizations and 10 patients in the ICU. This is significantly higher than the numbers we were seeing just a few weeks ago and higher than any other hospital system in the GTA. I've spoken with the leadership at Trillium Health Partners, and they attribute the increase in hospitalizations to the lower vaccine uptake in 6 specific neighborhoods, and I am going to list them: Mississauga Valleys, Applewood, Fairview, Sheridan, Rathburn, and Arundel. And a significant number of COVID admissions to the Trillium Health Partners, our hospitals, are coming from these areas. In contrast, the situation at Brampton's William Osler Hospital is much more stable, with a total of 10 COVID hospitalizations and only one person in the ICU. I am urging all our residents, and in particular those who live in those 6 identified neighborhoods, to go out and get vaccinated as soon as possible. We need your help to protect the enormous gains that we've already made against this virus. We need your help to protect Trillium Health Partners from the situation that we were in earlier this year, where the ICUs were overwhelmed and elective surgeries were being canceled. Peel Public Health has made it incredibly easy to get the vaccine. For example, you can walk into the Region of Peel's office buildings at 7120 here, Ontario, that's just north of Derry, anytime, Tuesday through Saturday, between 1 and 8 p.m., and you can get your vaccine. No appointment is necessary. We're also running numerous pop-ups and school clinics running each and every single day. The Vax Van is offering the vaccine today at Westwood Square Mall between 1 p.m. and 5:30 p.m. and again tomorrow from 10 a.m. to 2 p.m. The Vax Van will also be at 60 Dundas Street East on October 25th and the 26th between 10 a.m. and 5:30 p.m. The GoVax Bus Clinic will be at the Erin Mills Town Centre on Sunday, October 24th between 11 a.m. and 5 p.m. Our Lady of Mount Carmel Secondary School is hosting a vaccine clinic today from 5 p.m. to 7:30 p.m. with walk-in and appointments both available. Father Daniel Zanin is offering walk-ins and appointments from 5 to 7:30 p.m. tomorrow, as is Father Gates Secondary School this Saturday, October 23rd between 11 a.m. and 5 p.m. And on Monday, October 25th, you can walk in or book an appointment at St. Michael's Catholic School between 5 and 7:30 p.m. So if these times don't work for you, there are so many other dates available coming up in the coming weeks. And of course, you can always see your primary care provider or your local pharmacy. To find out all the information about pop-up clinics and school clinics, please visit the Region of Peel's website. I really can't stress enough that the vaccine will protect you, protect your loved ones, and protect the entire community. But it will also allow you to doing the kinds of things that are important to you and that you enjoy doing, including physical and your mental health, whether it's meeting someone for a bite to eat at a restaurant indoors or going to the gym. Like many other municipalities across the GTA, the City of Mississauga will now require proof of vaccination for anyone 12 and older participating in organized sports and recreation fitness activities at indoor city facilities starting on November 1st. This ensures that we are complying with the letter and instruction regarding youth sports issued last week by Dr. Lowe. Requiring proof of vaccination will help keep youth sports running throughout the fall and the winter. It will help us protect our schools and our businesses. And of course, it will help us protect our hospitals. In this regard, I want to thank the Ontario government for introducing the new enhanced vaccine certificate with a secure QR code last week, as well as Verify Ontario, the verification app that businesses and organizations will use to verify the enhanced certificates. Any resident who has been fully vaccinated can now download their enhanced certificate by visiting Ontario COVID portal at at covid19.ontariohealth.ca. You can save your enhanced vaccine certificate to your phone or print out a physical copy. With the new enhanced certificate, you will still have to show another piece of identification when entering a setting that requires proof of vaccination. I also like to take a moment to recognize our businesses, and in particular, our small businesses this week, as it is Small Business Week. I want to thank the thousands and thousands of business owners and their employees across Mississauga for playing such an important role in keeping our community safe. Throughout the pandemic, they've had to make incredible sacrifices, with businesses in Mississauga and in Peel facing longer closures through lockdown during COVID than anywhere else in North America. and we continue to ask them to step up, with businesses now playing another crucial role by having to verify customers' proof of vaccine to keep us all safe. We are seeing that the vast majority of our businesses are following the rules without hesitation. In fact, since the vaccine certificates have come into effect, our bylaw teams haven't issued a single ticket to businesses for failing to follow the rules. Thank you to all of our businesses for stepping up. So on Small Business Week, I'm strongly encouraging residents to make an extra effort to rally behind our local businesses. Please buy and shop Mississauga made. Order in takeout, visit that local coffee shop, or buy something from one of our fabulous small retailers. This might seem like small gestures, but they can be the difference between businesses staying open or having to shut their doors. Small businesses are the lifeblood of so many of our neighborhoods, and they need our support as much as they ever have. For those of us who have been fortunate to keep our jobs during the pandemic, please consider supporting those who are trying to keep theirs. I also know that there is a significant amount of frustration from our small businesses right now, including our restaurants, who have seen capacity limits on larger sports and entertainment venues fully lifted, while limits still remain in place for them. And I completely understand this frustration. I was hoping to see a more phased approach that slowly loosened the remaining capacity limits on all businesses at the same time. I think this would have ensured fairness and equity for all of our business owners, large and small. The Government of Ontario has promised to release a plan for small businesses this week. Along with business owners, I'm eagerly awaiting the details. I encourage the Government of Ontario to release their plan well ahead of when the new rules come into effect to allow the businesses time to prepare. Before I invite up Dr. Lowe, I just want to say that I'm very encouraged by news reports that the Ontario government intends to table legislation that will make it easier for foreign trade professionals and tradespeople to find work in their chosen fields. By removing barriers faced by newcomers when they seek employment in Ontario, most notably the requirement for Canadian work experience. This requirement has been impractical and unrealistic, and removing it will allow talented newcomers to begin working in their fields very quickly, and in some cases, immediately. We are also facing labor shortages across this province, and I believe this legislation will help employers find workers faster and will also help with our economic recovery. Mississauga is a city that has been built and strengthened by new Canadians, so naturally, we welcome this legislation. Mississauga, we are now well into fall and into a very enviable position, not only compared to the rest of Canada, but the entire world. Our case counts continue to drop more and more as more and more of you are getting vaccinated. We have a lot to be thankful for, and we have a lot to look forward to. But please, let's stay the course and do everything we can to protect the gains we've made so that we can ensure that we're all in this together and we can all be together during the upcoming holiday season. Keep following the advice of public health. Get vaccinated if you haven't, especially if you reside in one of those 6 neighborhoods that I've already identified. And I encourage you, and those of you who haven't been vaccinated, to please go out and get your shot. Speak to your family physician, speak to your friends, speak to your local pharmacist, but go out and get vaccinated. Thank you to everyone so much for their part in helping to protect our community. And now, I'd like to invite up Dr. Lowe to provide his update.
Thank you, Madam Mayor, and good morning. Mississauga's case rate this week is sitting at 24.7 new cases per 100,000, with a test positivity of 2.5%. With new numbers in from yesterday, nearly 83% of eligible residents in the region of Peel have now received 2 doses of vaccine. 34,000 first doses and 112 second doses still remain to get us to 90% 2-dose coverage for our eligible population in Peel. At this time, as we move into fall, our response goals remain the same. We are aiming to continue saving lives and preventing severity, especially amongst vulnerable populations, which increasingly include those who are not yet vaccinated. Preserving hospital and healthcare capacity, especially as the fall respiratory illness season approaches while our partners work to clear service backlogs. And mitigating the impacts of COVID-19 on our community, in particular, ensuring that we remain vigilant so that in-school learning can continue with measures in place and businesses can remain open. In respect of preserving hospital and healthcare capacity, as Mayor Crombie has also reported in her remarks, our partners at Trillium have reported a slight increase in the number of COVID-19 inpatients, now at 31, which is the highest census of COVID-19 patients among hospitals in the Greater Toronto Area. Our Trillium partners indicate that 95% of these patients are unvaccinated, and as Mayor Crombie listed out in respective neighbourhoods, many of these residents are from the Trillium catchment area of Mississauga, especially in south central and southeast Mississauga, in neighbourhoods that have lower rates of vaccination. As we work with our Trillium partners to investigate this signal, this is a reminder that we must all remain vigilant and we must all get vaccinated as soon as possible. To that end, Peel Public Health also supports the Chief Medical Officer of Health's commitment to a gradual reopening. With cooler weather soon upon us and socializing and meetings moving indoors, we need to be cautious to continue to prevent spread and severity. Vaccination, preventive measures such as certificates and masking, and getting tested and staying home if you are sick continue to be a minimum. But vaccination is the foundation and it is the most important line of defense for us all. So I ask you again, please access your 2 doses if you haven't already. You can visit peelregion.ca/COVID-19 vaccine to learn about clinic offerings, where you can walk in or book, and also have your questions answered. In the meantime, though, adherence with the new proof of vaccination requirements will help to protect those who are not yet vaccinated from severe or mortal outcomes. I also wish to highlight that if you've had COVID-19 before, you should still get vaccinated. Evidence is increasingly clear that vaccines boost your post-infection immunity and can help prevent reinfection. To that end, I also encourage all residents to get vaccinated against flu as well. We anticipate much more flu activity this year than last as we also move indoor and keep our community open. The protection of the influenza vaccine is also critical and can be accessed at primary care and pharmacy locations in the coming months across Peel. Finally, we've seen an increase in outbreaks in our community linked to returning travelers. I wish to encourage residents that are traveling out of Canada to comply with all precautions on their return, notably for those who have children who are not yet eligible for vaccination that are traveling with them. Guidance states that while these children do not necessarily need to isolate fully, they are to avoid large groups of unvaccinated children at this time to limit transmission in certain settings. Ultimately, though, vaccination and vigilance will get us all through this, and I thank all of our residents for getting your 2 doses and doing your part to stay safe. Thank you, and I'll pass it back to Mayor Crombie.
Thank you, Dr. Lowe. And now, along with Dr. Lowe, Chief Darren Rizzi, Chris Giles, and our City Manager, Paul Mitchum, we are all here to answer your questions. To the media.
Your first question comes from Steve Cornwell at the Mississauga News. Go ahead, Steve.
Welcome, Steve.
Good morning, Mayor Crombie. How are you?
I'm so very well. How about you?
I'm good. Actually, my first question was for Dr. Lowe, if I could have him.
No problem. I'll bring him back up here right now. Dr. Lowe?
Yeah. Hi, Dr. Lowe. We learned recently that Pfizer has applied for approvals to vaccinate children 5 to 11 in Canada, and I'm wondering what, if any, impacts this would have on Peel's current immunization plans? And if there is an approval for that age group, is it possible that mass clinics will reopen?
Yeah, thanks so much for the question, Steve. As part of our fall planning, we are anticipating the opportunity to vaccinate pediatric doses for children under 12 in the 5 to 11 range that one pharmaceutical manufacturer has applied for. It is anticipated that we will be using all available channels to provide opportunities for children to be vaccinated. That will include our mass clinics, potentially opening additional sites if needed, and certainly our ongoing mobile clinics, which are available across the community and will likely possibly even enter schools, to try to make sure that we are providing as many opportunities. I think it is really important for me to state this as well. As we move towards the fall, there are a lot of different changes to eligibility that are anticipated. We know that there may be additional third dose eligibilities that are opened up. We also know that with the 5 to 11, that will be a significant draw on resources. So I think it's really vital for me to say that I think our priority as a community will be to try to figure out how we vaccinate, which groups we vaccinate using our resources to ensure that we bring the acute phase of the pandemic to an end. And to my mind, depending on what comes out, the most important will be to try to get 2 doses to people who still remain unvaccinated and also cover off our 5 to 11 group, because that will essentially render the virus as non-novel as possible for the vast majority of our residents. Boosters will certainly be important, but again, I see those on a different priority than making sure that we finish the last mile and get 5 to 11 vaccinated. Thanks so much for the question.
Thanks. And I guess the second question is for you, Mayor Crombie.
Yep.
Yesterday, during the council meeting, when Paul Mitchum was going over the employee stats, I believe the numbers he said there was 50% of MyWay staff had disclosed their vaccination status, and around 75%
77.
of part-timers had done the same. Mm-hmm. Could you clarify whether those are what the vaccination rates are among those people that did disclose? Was it?
Yep, I'm going to ask Paul to come up and answer that question, but we're very happy, actually delighted, that 90% of our employees who have disclosed already are vaccinated. So that is really good news. The balance who have not yet disclosed to us make up a lot of the part-time workers and ATU employees as well. And it's because of the nature of their work, the shift work, that it's been cumbersome to report in to disclose. So we're going to extend the period of disclosure for them so that we can better capture their rates. So it's undetermined at this point because we still need the data from them, Steve. So Paul, why don't you come up and explain further on the ATU and part-timer rates? Thank you, Steve.
Thank you very much, Mayor Crombie, and good morning, everyone. I think really Mayor Crombie summarized it probably in the appropriate way, that we're making good progress. We are virtually complete in all of our employee areas, with the 2 exceptions, part-time employees and ATU. Within both of those areas, it's a similar problem in terms of the logistics. Large number of employees, working shifts, multiple locations, working weekends, and so on. So the ability to connect with those employees, I won't say it's limited, but it's a challenge. We've also, according to our policy, mandated that we must see the vaccination certificates. And it's really on that basis to protect the freedom of privacy of information for health information. So we're not allowing employees to submit information by text or by email. The manager or the supervisor must see those results. So that then is taking more time. We're making good progress. I think Mayor Crombie gave you the statistics in terms of where we are to date. And we're optimistic over the next few days, several days, that we'll reach what I would call completion against those 2 areas. And then we'll move to the next phase of the employee policy. Thank you very much, Steve, and I'll turn it back to Mayor Crombie.
Thank you, Steve. Next question, please.
Your next question comes from Camille Fireson from CBC Radio Canada, and the question is for Dr. Lowe, actually.
No problem.
Okay, go ahead, Camille.
Thank you, Camille.
bonjour. J'aurais la même question qu'on vous a posée précédemment, un petit peu plus tôt, pour savoir qu'en est-il pour la vaccination pour les enfants de 5 à 11 ans, à savoir si c'était quelque chose pour laquelle vous vous préparez et comment la santé publique de Peel se prépare à ce propos.
Oui, alors merci beaucoup pour la question, Camille. On va répondre premièrement en français et puis en anglais. Nous avons des plans pour utiliser tous les lieux comme les autres lieux de notre campagne de vaccination. Alors, il y a des cliniques masse pour la vaccination, aussi des cliniques mobiles et des opportunités dans les soins primaires et aussi dans les pharmacies. Mais dans ce moment, nous sommes en attente de l'approbation de cette vaccin de Santé Canada. Et après, quand nous avons l'approbation et aussi les guidances de notre partenaire provincial, on peut aller avec ce programme de vacciner nos 5 à 11. Mais dans ce moment, il y a un plus important message pour tous les résidents de Peel. Si vous n'êtes pas vacciné maintenant, faites-vous vacciner, protégez-vous, protégez votre famille et aussi votre collectivité. So thanks so much for the question, Camille. We are basically preparing every channel that we can to vaccinate 5 to 11. We will be using mass sites, mobile sites, and also primary care and pharmacy channels. Mobile will go into different places here and there. And of course, we're really focused as well on getting ready to go once the federal government provides its approval, and we also have guidance from our provincial partners. But really the most important message is that even while we're waiting now for those who are eligible, it is really important to make sure that you're vaccinated to protect yourself, your family, and your community. Avez-vous une autre question?
Oui, juste une question pour une précision. Est-ce que ce serait possible d'imaginer que cette vaccination pour les enfants de 5 à 11 ans puisse avoir lieu dans les écoles ou en priorité ce serait dans des centres de vaccination comme ça a lieu pour les adultes?
Je pense que les détails de ce plan est en train d'être finalisé, mais dans ce moment, nous avons des cliniques mobiles dans les écoles pour des jeunes qui sont à 12 à 17 ans, et je pense que ça peut être une opportunité d'avoir des enfants avec famille dans un lieu familial, et je pense que ça peut être un des lieux de notre programmation pour notre campagne pour les enfants 5 à 11. Alors en anglais autrefois, I think we are looking at all options at this point in time. We already have school pop-up clinics for our youth that are 12 to 17, and we would also certainly look and consider the question of whether you have 5 to 11s in a place with their families that might be maybe a bit more familiar. These are all certainly being worked out and finalized at this time. Thanks so much for the question.
Next question, please.
Your next question comes from Natasha O'Neill at The Pointer. Go ahead, Natasha.
Welcome, Natasha.
Hi. I'm going to start with a question about the election. So we had now Prime Minister Justin Trudeau visit Mississauga a number of times, but he did not promise any specific funding for infrastructure, which was something that the city was hoping to have. Mm-hmm. This gap that we were expecting is going to grow. So I'm wondering if the federal government cannot give the city more money, where can Mississauga make up this giant infrastructure gap?
Well, I think there is good news because big city mayors met in Ottawa last week, and the Prime Minister joined us for those meetings, and we repeated our requests for continued ongoing infrastructure support, transit support, restart funding for our operational deficits as a result of COVID. We also talked about housing affordability, homeless issue, the opioid crisis, and of course climate change is another big item on our agenda. So we discussed these issues with the Prime Minister, and he's very interested in listening to the big city mayors of Canada, and also talked about a new federalism on ways that he could, channel funding to us more directly, as he's done with the gas tax previously, which is now called the Canadian Community Fund, I believe. So we had a very productive meeting with him, and then the following day, the Ontario big city mayors met, and many of us that had been in attendance in Ottawa were present, and we conveyed the information. So, Natasha, we're very hopeful that the funding stream from the federal government will continue. We've reiterated many times that it has to be sustainable, long-term, reliable, etc. So I'm very hopeful because, as you well know, we have very limited means to collect revenue. Our primary source is property tax, and then we rely on transfers from other levels of government, the gas tax, etc., and then user fees. And then, of course, development charges add to our reserves when we are in the growth phase. So, as you know, it's very limited, but of course we always apply to federal or provincial governments when we're trying to build those large aspirational infrastructure projects, such as we have with our LRT, and we have as well with the marina funding we need to rebuild our marina. So this will always continue until there is a new federalism, or until we receive new dedicated long-term sustainable funding, perhaps new revenue tools for cities.
Follow-up?
My follow-up will be for Dr. Lowe. Thank you.
Thank you. I'll invite him up.
Hi, Dr. Lowe. Since you mentioned the influenza vaccine and you pushed people to go and get it, we know that that's another step to protect ourselves from COVID because it keeps up our immune system from other things. I'm wondering if Peel Public Health is planning on doing anything of the sorts like vaccine buses, but just for the influenza vaccine, as we've seen that it's important to have access towards these sorts of things over COVID.
Thanks so much, Natasha. In fact, our plan for influenza makes use of over 700 different locations in our community because it is going to be distributed through traditional mechanisms, primary care and pharmacy. Our past experience has shown that, with significant coverage across our communities, across almost 700 sites, spread out around our community, that we often do manage to access, and individuals are often able to access influenza in our community. So at this point in time, recognizing that many people who have already had the COVID vaccine are protected against COVID, they can certainly find their local pharmacy or, visit their family doctor starting, next month, as for the general public to access flu vaccine, recognizing that the rest of our resources in public health are really committed to that last mile, to getting 5 to 11, to getting, the last 90%, the last group to 90%, and then, of course, continuing boosters for those who may have waning immunity. That's our priority to end the pandemic, and flu will be handled by our network as it always has been. Thanks so much for the question.
Next question, please.
Your next question comes from Declan Finnegan at Mississauga. Go ahead, Declan.
Welcome, Declan.
Declan, are you there?
Yes, I'm here. Can you hear me?
Okay.
We can hear you. Thank you.
Good morning, Mayor Crombie.
Good morning.
Good morning, Mayor Crombie. How are you?
I'm so very well. How about you?
Good. I'm excellent. Thank you. I'll have a couple of questions, but just the first, based on what you said a few moments ago, those 6 neighborhoods of Mississauga that you identified as having poor vaccination rates. What at this point in the game now, what extra can you do? What extra incentives can you give communities if they're not already fully vaccinated or on the way to becoming fully vaccinated? At this point, what more can you tell people?
Yep, I'm going to list them again because I think it's so important they know who they are. And if you live in one of those communities and haven't been vaccinated, please know we're coming for you. So we're going to make more targeted efforts to go into those communities to reach those individuals, and they are Mississauga Valleys, Applewood, Fairview, Sheridan, Rathburn, and Arundel. We encourage everyone in those communities who have not yet been vaccinated to go out to either one of the permanent clinics, to the Vax Van, or one of the many pop-ups that are in many of our high schools. And I listed those earlier as well. There are a lot of information on the portal. Just go to regionofpeel.ca, and there's all the information on where you can go get vaccinated. You can also go to your local pharmacy or your primary care provider. So, Dr. Lowe, do you have any additional plans for these 6 neighborhoods? I'm going to invite him up to answer as well. Thank you, Declan.
Thank you.
Thanks, Mayor Crombie. And certainly, I would start out by just saying, there's a number of incentives, Declan, that I will just list off very clearly. The sooner people get vaccinated, the sooner the acute phase of the pandemic ends and we go back to normal. And also getting vaccinated is great because it prevents you from death or severe hospitalization. I think those are, if those aren't incentive enough, I don't really know what else I can say to some degree. But, in respect of those neighborhoods, Peel Public Health is constantly looking at the data. We had identified that. And in fact, when we were speaking to our Trillium Health partners, they were seeing, you're essentially seeing it bear out because we're seeing where those low spots of uptake are in our community. And that's being borne out in the admissions that are now showing up starting to tick up at the hospital that we're continuing to now closely monitor. With that data, Peel Public Health has targeted specific pop-ups. We've targeted more mobile efforts in there. We're working with community and cultural groups we've been in some of those neighborhoods, we've gone door to door. We're continuing to go door to door. But this is a bit of a slow slog, right? Because this is now you're trying to get to person and, convincing them, answering questions around entrenched beliefs. And so I think to some degree, those efforts are continuing, but they are slow. But in the event that you are someone who lives in a neighborhood with lower vaccination, just know that, we are seeing greater activity there and people are ending up in hospital. Why take the chance? I think it really is clear after billions and billions of doses have been delivered worldwide that the vaccine is safe, that's effective. Just take a look at where we are now this year compared to where we were last year at the end of October. I think the proof is in the pudding and those incentives really do hold. Thanks so much for the question.
Thank you.
And Declan, that's not to say that their rates they're just lower than average in Mississauga, shall I say. We know that the average rate, we're now up to 80%, over 82% fully vaccinated, and these rates are hovering in the 70s and 60s. So we just got to get them up a little bit. I was just checking that offline. Next question, please.
Sorry, yes, thank you. Just as far as the City Council and General Committee meetings are concerned, when do you plan to fully resume in-person meetings with all councillors, staff, and the public inside council chambers?
Yeah, so there is a plan to do so and bring back all of our employees as well. So we have the option now of coming in. I think most of our councillors feel more comfortable. As you know, we have 12 cubicles here, we have 12 cubicles and there are 11 of us. They like to spread it out so that 6 come in and we kind of rotate that a little bit. I come in for council meetings and stay back for general committee to give someone else a turn. But just as we're reintegrating all of our employees back to City Hall, Paul, probably by the new year, but given flexibility as well, will probably be the same with council. But we do have that option today. As you know, we have the plexiglass barriers and we all wear masks as when we're in the hallways and in our offices. So there is that opportunity for council members today. But some of them still prefer to do them remotely or virtually from home.
Your last question comes from Khaled Salama at My Second Home TV. Go ahead, Khaled. Khaled? Oh, I'm just trying to unmute him and it's not letting me. Khaled, are you there? Unfortunately, we can't. Khaled, are you there? Hello, Khaled?
Yes, can you hear me?
There he is.
Yeah.
We can hear you now, Khaled.
Great, thank you so much. So for the city staff and workers who choose not to share their vaccination status, Mayor, how often they have to provide the negative test? Is it every day? Because you mentioned just before the shift, and some of them will be working on daily basis. So how you will be looking into that?
Okay, so I'm going to ask Paul to respond to that, but obviously some of them are in shift work. I think the standard is 72 hours prior for a rapid antigen test, but if possible, we have applied for those provincial government rapid tests, and those can be easily done right ahead of shifts or within the 24 hours. Paul, why don't you come and speak to the rapid testing that will be expected from our employees?
Thank you, Mayor Crombie. Yes, as the mayor basically outlined, for employees that are coming to work every day, people on the front line, for example, they'll be required to test 24 hours in advance and to provide a test every 2 weeks. For employees that come in only periodically, they'll be required to test 24 hours in advance and submit those results to their manager supervisor. And so that's our plan. That's the best practice. That's the advice that we've had from our occupational health and safety physician. That's our program. And that will, for those people that are not vaccinated, will be mandatory testing. Thank you so much. And back to Mayor Crombie.
Thank you. Thank you. The follow-up, Mayor Crombie, how severe the cases in Trillium Health Partners? Are they always on ventilators and respirators?
Yeah.
So
we have 31 individuals with COVID who are hospitalized right now and 10 in the ICU. And you can see that even at Brampton's William Osler, they have only 10 individuals who are hospitalized with COVID and only one person in the ICU. So the Mississauga numbers this week are a little higher. Of course, we're concerned, but we'll monitor them closely and very hopeful that they will come back down. Because our cases have been coming down. We were at 33 cases per 100,000 last week. We're 25 cases per 100,000 this week. So cases are coming down, but there seems to be an influx of people being hospitalized with COVID this week.
That was your final question for the day, Mayor Crombie.
Okay. Thank you all for joining us today.